is about feeling good mentally, physically, and spiritually. Doctor, what are your thoughts in this?
Yeah, actually, general well-being is not a complete absence of disease. It is a combined action of mental, physical, as you told, and spiritual well-being. And in Ayurveda, it is a concept that our body is composed of dosha, dhatu, and mala. Dosha, dhatu, mala, moolam hi shariram. It is mentioned like that. And for attaining a swastha, means a normal, healthy state, one should achieve sama dosha, sama dhatu, sama mala, and sama agni. Digestive fire should be corrected. The tridoshas should be in a normal state. Sapta dhatu should be in a normal state. And Ayurveda aims this concept for being a healthy well-being.
That bring it back.
Yeah, to maintain the normalcy of a healthy individual, and if we consider a unhealthy or a diseased person, to bring that person from the diseased condition to a normal state. That is the main aim of Ayurveda, considering the concept of well-being.
Okay. What about you, doctor? What do you feel?
Actually, considering this general well-being aspect, Siddha addresses it the same way. Actually, that ഉടമ്പാലഴിയിൽ ഉയരാലഴിവർ തിടമ്പട മെയ്ഞ്ഞാനം സേരവുമാട്ടാർ ഉടമ്പൈ വളർക്കും ഉപായം അറിന്തേൻ ഉടമ്പൈ വളർത്തേൻ ഉയർ വളർത്തേനെ. That means if you are safeguarding our body, that has to be given primary importance, because safeguarding the body will help us do more karma and thus eradicate, and there is an aim like that to get merged with the supreme like that. And that is a basic concept behind every Siddha aspects. And every medicines and treatments will be oriented towards this aspect. So every medicines will have either of this aim. Definition of medicine itself is like one that cures physical ailments is considered as medicine, one that cures psychological ailments is considered as medicine, and one that prevents diseases is also considered as medicine. These are these three classes of whatever the material may be that can be considered as a medicine. So as doctor already told, that normalcy or homeostasis of the body, once it is lost, that condition is called a disease. So restoring that homeostasis or restoring that well-being is the primary importance of every treatment and every medicine. So that imbalance will be happening because of several factors. Some can be because of our lifestyle, some can be because of some other malfunctions inside the body, so like congenital malformations or something like that. And on the other hand, psychological aspects will also come into play, and that can also cause this derangement. And this derangement, restoration of this derangement, is the primary aim of all the treatments and all the medicines.
Okay. For a normal person, how can he be healthy? Like, is there any regimen or something we can follow so that we can prevent or make diseases stay away for a while?
Yeah, sure. In Ayurveda, there is a concept of Panchakarma, means 5 types of biopurification. Okay. We cannot call it as a detoxification. It is not just detoxification. Whole doshas, deranged doshas can be kept in a normal state, and the disease will not recur. There will not be a punarudbhava. The disease will not occur again. That is the concept. It is the Panchashodhanas are Vamana, Virejana, Vasti, Nasya, and Rakta Mokshana. 5 types. And before that, these procedures, we are doing Purva Karmas. For a layman, the concept of Ulichil, Pidichil, they are calling it as or termed it as a Panchakarma. Literally, it is not Panchakarma. They are the preparatory procedures for Panchakarma. We are actually preparing that body for Panchakarma, for doing that Panchakarma. That Purva Karmas include the Ulichil, means Abhyanga, oil bath, etc. Then Swedana, fermentation procedures, that poultice, or already we have discussed that Kiris, Ilakiri, Podikiri, Nyavarakiri, all Kiris are coming under that Purva Karmas only. The main Panchashodhanas are the Vamana. Vamana means to expel the kapha dosha, excessive kapha dosha from our body. And Virejana means purgation. Excessive pitta is eliminated from the body. And nasya means above. We are instilling the oil, either oil or asava decoctions, medicines can be instilled. And rakta mokshana means bloodletting procedures. It can be done through jaluka, leech therapy, and venesection. Vein can be. Then coming the vasti or enema procedures. Different types of vastis are there. We are mainly doing it according to the condition of the patients. These are the 5 panchashodhanas we are doing for the general well-being.
Doctor, is there anything you can add based on the regimen or something like that similar?
In Siddha treatment, this entire preventive aspect is given that much importance. We used to call it Spini Anaga with the Olukam. That those prophylactic practices that we have to keep in our daily lifestyle, like that. It is more towards the daily lifestyle of a person, like when we have to get up, when we have to eat the food, what type of food we have to eat, when we have to do these type of cleansing procedures, like Vamanam, Virejanam, Nasyam, all those things, when we have to do, what has to be the frequency of those procedures. And beyond that, there are Tokkanam procedures also, like this Agni Karma, that Attai Vidal, that Jaluga Vajarnam we used to call Attai Vidal. Like that, Komburanchal, there is a bloodletting procedure using just that stick, like that. And there are a lot of procedures like that. Agni Karma is also there. And these procedures, all these procedures are aimed at what we have already told, like restoring the balance. And all these Purva Karmas or the preparatory procedures, after that we will be doing Vamanam, Virejanam, Nasyam, and also this bloodletting procedure wherever needed. And particularly for a layman or for a common man who is leading a busy life, this that primary thing that we have to do is the Virajana procedure, that we can do in our can be a part of our routine. The recommended method is at least you have to cleanse your entire system once in 4 months. But due to busy schedule, we recommend at least once a year they have to cleanse their abdomen. Before cleansing that cleansing procedure, you have to do the Purva Karma, like intaking ghee, that is Nehapanam, and include Abhyanga, that can also be done. And the primary aim for those Purva Karma is to bring those doshas to that to that alimentary tract, so that can be eliminated through our feces or urine. That is the only 3 ways we can eliminate these doshas, these impurities. That is not like there are a lot of toxins accumulating. It is like stagnations, like that we can say. So every channels in our body will be cleansed through these preparatory procedures and these cleansing procedures. That is the basic concept behind that.
Similarly, in Ayurveda also, Dinacharya, Ridhucharya, etc. are mentioned. In Dinacharya, this Abhyanga, how we should do Abhyanga. Actually, doctor have told how much diet we should take. In Matra Shidhiya, how much quantity of food should we take. How much time we should do exercise. Everything is mentioned in a clear way. In Ridhucharya also, this concept of Panchashodhana, as I have mentioned, it should be done in particular Ridu. Varsham, Sharad, Vasantam. In 3 Ridus only we must do this Panchashodhana. It is clearly mentioned in Ayurveda also.
Doctor, do you recommend any medications that you can take, like supplements, to just maintain good health?
Actually, that also depends on that dhatu dosha. We cannot directly predict a medicine for a general public, but in general terms, you can take at least oil bath using sesame oil. That is a better recommended thing. That can be done once in 4 days. If time doesn't permit, you can do it at least once a week, like that. That oil bath is recommended for everyone. And also oil intake, like you can take castor oil once in 4 months. That can be done as a home remedy to cleanse the alimentary tract and to cleanse our rectum, so that the digestion will be improved and the assimilation will also be improved. Thus, we can prevent whatever the accumulations or whatever the stress related toxins that is accumulating, not like toxins, stagnations that is happening inside our body, that can be prevented. So that can be made as a regular practice.
Also, Rasayana can be internally administered. during for the purpose of well-being.
Type of rasayanas.
So many Narasimha Rasayana. According to the condition of the patient only, we can suggest what all Rasayana can be administered. Several types of Rasayanas are mentioned. Brahma Rasayana, Narasimha Rasayana. For brain development, Medhya Rasayanas are mentioned. We can select accordingly.
Siddha also it is there. Actually, we used to call like Narai, Tirai, Pini, Moopu, Sakad. All these has to be prevented. These are the signs of aging. These has to be prevented like that. That is the aim of every Siddha treatments. So every medicine that we administer for a curation will have some level of rasayana property. That is the basic nature of every medicine. So such rasayanas, particularly in Siddha, there is a class of medicines which are called Karpa, Avidam, like that we will be. That includes Mani, Mandram, and Avidam. There are some magical practices and also that were done during that time. And now we are concentrating on herbal remedies that can be single herbs that can be taken regularly to prevent all these diseases. And also these signs of aging can be delayed like that. That means once the signs of aging is delayed, that means our body is maintaining its homeostasis. That is the concept of Siddha.
So, in conclusion, maintaining a healthy lifestyle and with periodic biopurification is as important as curing a disease. Thus, prevention is always better than cure.